So Glasgow has got a proud history of innovation. It was a pioneer of the first industrial revolution. And Glasgow is now transforming itself to play a leading role in the industries of the future. The Living Laboratory for Precision Medicine is using Glasgow's existing strengths in precision medicine. That is the University of Glasgow's internationally leading researchers, our strong life sciences industry base, our largest health board in the UK, to develop innovative products and services which will support Scotland's economy, reshape people's lives for the better. Precision medicine brings more accurate diagnostics and treatments that are tailored to individual characteristics rather than populations. Precision medicine is often thought of as genomics, but it's far broader than that. Indeed, the approach that we are taking in Glasgow is applicable to the development and the adoption of a very wide range of innovations in healthcare. This provides a game-changing opportunity for Scotland, and particularly for Glasgow. I'm going to give a brief overview to set the scene for our expert panel discussion. Over several years, precision medicine has been a catalyst for the development of Glasgow's strong triple helix partnership working that you heard mentioned in the introductions. That is bringing together academia, industry, and our NHS. And that partnership working now extends to Glasgow City region and to our communities and across Scotland. Working with NHS and Glasgow City region, we've invested in infrastructure for research and innovation at the £1 billion Queen Elizabeth University Hospital campus, which is Europe's largest university hospital and is part of Glasgow's growing Riverside Innovation District. We created our clinical innovation zone for industry, embedded in that hospital campus. And that now has 14 tenant companies embedded there, including large companies such as Canon Medical and smaller companies that have joined us from California, Germany, and Singapore. And you will hear from one of these companies, Bioclavis, in the panel discussion, and also from the Precision Medicine Scotland Innovation Centre, which also located in our clinical innovation zone. And these strong partnerships really are the foundation of our recent successes. In 2019, we carried out a science and innovation audit on behalf of the UK government. This was important as it demonstrated that the global market for precision medicine is growing, perhaps even exponentially growing, and it's estimated to be worth $134 billion by 2025. The Science and Innovation Audit evidenced Scotland's strengths, and in particularly the opportunity for Glasgow to attract a share of this global market. However, it also identified the challenges of adoption and of mainstreaming of innovative technologies into healthcare. And that's particularly true when these technologies are disruptive. And it was understanding both our strengths and challenges that led to the development of the Living Lab for Precision Medicine. And I'm delighted to be the director of the Living Lab, which, as Mr. McKee said, is the UK's largest investment in precision medicine, totalling over £90 million in this programme alone. Building on Scotland's £1 billion investment in the Queen Elizabeth University Hospital campus, our aim is to address the challenges of adoption of healthcare innovation and take the promises of precision medicine into a real-world clinical setting. The Living Lab brings together a consortium of leading organisations across industry, NHS Scotland, academia and others. And we're using our collective strengths to develop, validate and support the adoption of new technologies into health. The Living Lab investment will also expand our hospital campus, and our new Health Innovation Hub will bring additional purpose-built space for new companies with facilitated access to world-leading researchers, including data scientists and engineers, as well as the best clinicians and Scotland's rich health data assets. We've got an ambitious vision to grow the life sciences cluster around the Queen Elizabeth University Hospital. And our consortium partner, Condensed Science Partners, is with us on the panel today. If I can get the slide to move, that's us. So moving on to the projects and what we're actually doing as part of the Living Lab, we have got a variety of multidisciplinary exemplar projects already underway. And these range from advanced imaging projects, for example, 7 Tesla MRI coil development and radiogenomics, through to projects around pharmacogenomics and transcriptomics. These projects are designed to enable the adoption of new technologies, support companies and researchers to develop new innovations, and also to build assets for Glasgow and for Scotland. These projects are exemplars. They're really interesting in their own right, but we're also keen to support new projects using the assets that we're building. And as part of our expanded campus, we are also creating a new digital health validation lab where digital innovations, including apps, devices, and sensors, can be developed, tested, and validated, importantly alongside researchers, clinicians, and patients. And I want to touch just briefly on the Lighthouse Lab in Glasgow. At the start of the pandemic, we were able to quickly draw upon our partnership working with industry and the NHS to develop a COVID testing lab from scratch. And this very much came out of the partnership building that we've been working on over the last few years. And working with Bioclavis that are here today, we ramped this up to become the UK's largest COVID testing facility, which has now analysed over 25 million COVID tests, as well as increasing our understanding of COVID biology and supporting vaccine trials. And we've been doing that by working in partnership with researchers and with the NHS. And importantly, over the last 18 months, we have trained and upskilled over 800 staff. And these are now a valuable asset to Glasgow and to our growing industry cluster. So I want to finish just with a brief summary of why Glasgow. Well, firstly, we have got the best of the UK's research and clinical excellence, and that's been demonstrated over the last couple of years through our role in the pandemic. Our partnerships with the NHS and with industry are genuine, and I hope that you will hear that and get a sense of that when you hear from our panel. We also have this significant skills base, going right through from our schools, our colleges, and our universities, and also now from the upskilling that we have done through the Lighthouse Lab. And our investment in the Living Laboratory is accelerating the development of our ecosystem for precision medicine to benefit companies, our NHS, and importantly, our patients and communities. And finally, something I haven't touched on yet, but the Living Laboratory in the Queen Elizabeth University Hospital is situated in Govan, which is an area of high deprivation, but has got huge opportunities for inclusive growth. And I would draw your attention to the UK's Levelling Up paper, which came out just a few days ago, where importantly, Glasgow was chosen as one of 3 cities across the UK, which was ripe for significant government investment in innovation. So to finish, I'd like to invite you to join our vibrant precision medicine cluster in Glasgow. The Living Laboratory is open to new collaborations to support economic development and provide benefits to patients and the NHS. Thank you.